Cataracts. So what are cataracts? Cataracts occur when the lens of the eye, which is normally clear, becomes cloudy due to a breakdown of the proteins that make up the lens. The lens of the eye is made up of proteins called crystallins, and the arrangement of these proteins within the lens is what causes the lens to be clear, allowing light to pass through and reach the retina at the back. So, what are the symptoms of cataracts? Well, you will have the vision becoming dim, blurred or cloudy. There will be difficulty seeing at night. You find yourself becoming more sensitive to light. You will find yourself needing brighter lights for reading as well as other activities. There's a possibility of seeing halos around lights. You may find yourself frequently changing eyeglasses or contact lens prescriptions. There may be also a yellowing or fading of colors and possible double vision in one eye. Initially, you may not notice any vision issues with your eyes because the cataract will only affect a small portion of the lens. But of course, as it grows and more of the lens becomes affected, you will begin to get symptoms. So what exactly causes cataracts to form? Cataracts usually develop when the aging process or injury changes the proteins and other substances that make up the lens. With age, the lens becomes thicker, less flexible, and it is not as clear as before. The proteins and the fibers break down and clump together, and this is what results in cloudy vision. Now, cataracts usually occur in both eyes, but they will not grow at the same rate, and hence a difference in the quality of vision between the eyes. Now, there's also something called congenital cataracts. This is something you were born with or you develop in childhood. These types of cataracts may be passed down from parents or associated with infection or trauma while in the womb. So what exactly are the factors associated with you having an increased risk of developing cataracts? Well, there's age, diabetes, overexposure to sunlight, obesity, smoking, a family history of cataracts, eye injury, infection or inflammation of the eye. Eye surgery can also increase your risk of developing cataracts. Also, long-term use of steroid medication and excessive alcohol consumption. Of course, the logical question here is, how do you prevent cataracts or at least slow down the progression of cataracts? Now, while there is no way I can say doing such and such will guarantee you will not develop cataracts, there are some logical and practical steps you can take to give yourself the best fighting chance. Firstly, you need to get regular eye exams so problems can be caught early and a plan put in place. During eye exams, the doctor may find additional issues that can be treated with medication and helps give you an overall improved vision. Also, quitting smoking. Smoking leads to an increased amount of free radicals, which increases the chances of you getting cataracts, as well as it leads to an overall reduction in your eye health. Also, reduce alcohol intake. Too much alcohol can lead to an increased oxidative stress on the eye, which the body has to deal with. Also, you can increase the quality of your diet with an adequate amount of fresh fruits and vegetables to increase your antioxidant intake. And you can also look at possibly supplementing with an antioxidant supplement. You can also protect your eyes from excessive UV radiation from the sun by wearing sunglasses that block UVB light. Sun exposure has its benefits, but don't get too much of a good thing. So how exactly are cataracts diagnosed? The first step is the dilated eye exam. Eye drops are used to dilate the eyes or open up the pupils so that the eye specialist can examine the lens as well as the retina at the back of the eye. This is so cataracts as well as other eye problems can be detected. Additional tests such as the vision field test, eye pressure testing, and retinal scans can be performed as part of a more in-depth eye examination. So how exactly are cataracts treated after they are diagnosed? Initially, glasses may be prescribed. However, if they don't work or stop working due to the progression of cataracts, surgery may be the only option. The basic premise of cataract surgery is removal of your natural lens and replacing it with an artificial lens. So I hope you enjoyed that very brief overview on cataracts. If you're having blurry vision or declining vision, I advise you book a dilated eye exam to get a proper diagnosis and get your treatment started.
We do dilated eye exams and cataract surgeries. You can call us today at 7475-297 or 308-3370 to book your appointments. You can tap the description below for all of our contact information.